Hi, it's Brian. And
I'm Tiran.
hey, today we're going to focus a little bit more on medical. Specifically, we're going to talk about wounds, whether it be punctures, abrasions, or a laceration. And we're going to go through an escalation of resources that you may want to consider, resources that we've personally used. And these are just a sample of some of the things that Tiran and I have. We pulled them out to kind of show you. Everyone has some Band-Aids, I'm sure, in the house, whether they be your typical Band-Aid or, like my wife, she likes a more of a natural bamboo Band-Aid. Going on up, you may need gauze and tape, different type of bandages for a larger wound or an unusual that a Band-Aid won't work. Next, there's Steri-strips. If you're not familiar with them, it's like tape with traction, and it'll kind of hold things together. Think of it as duct tape. They even have some that you actually put in and you can pull them tight, like a pair of shoestrings.
Replaces sutures if you can get away with it.
If it can get away with, exactly. So there's more information we'll share on how to evaluate that. Something that I don't use anymore is a liquid bandage. And it's just, I don't want that absorbed, some of those chemicals absorbed in my body. It sounds contradictory, but you can use super glue as you close the wound, and then you can use super glue to actually keep the wound. Again, depending upon, as Tiran was mentioning, what a Steri-strip worked better and something that actually drew. Many people aren't aware that there are additional compounds, such as some type of wound bed. There's a powder that you can actually use. So if you have a profuse wound, there are powders, and they come in different size, and bandages that have some type of coagulant that actually stops your body from bleeding out.
How's this different from the glues and the adhesives?
So, good question. This you pour directly into the wound bed. It mixes with your body's own blood, and it acts like a super scab, an instant scab. Now, I'm getting to, there's been a revolution that I'll in that industry, which I'll cover in just a second. One of the things that Tiran has in his kit, and that I've actually bought my daughter and etc., is you can buy a suturing kit. Tiran, you want to share a little bit about your practicing here on making a suture?
So one of the things is if you're going to want to have experience on field medicine, you're going to want to learn how to do sutures. There are videos, there are resources that we have on our bepreparedsolutions.co. But having this is imitation skin. It feels like real skin. It has different patterns. It allows you to practice suturing and without having to injure someone on purpose. It lets you practice the different needles and thread sizes. There's a whole world of how do you do sutures, how do you choose them. Great thing to practice on. You can do it before you need it so that you have the practical experience.
Don't wait till you need it. So if you ever think you're going to want to be able to do it, practice now.
Everything that we're talking about here this is for when help isn't coming. So this is about self-sufficiency, learning how to do things that otherwise we all go to the local urgent care, right?
Yeah, I do. I do. So, hey, there's something, and I wanted to share out. This is kind of a revolution that's recently come out in the marketplace. And these are single use, but they actually have a spray now that acts like the powders, but it's a spray, and it's a hemostatic spray, which is a fancy word for saying for blood. And the reason I'm a proponent of it is it has literally saved my dad's life just a couple months ago. He's on a blood thinner. He had a severe injury in his workshop, and he was able to use this and stop his blood from bleeding, and he's on a blood thinner. Otherwise, he would have bled out. So, again, this is a continuum. We have tried, as you can see, a myriad of products. And if you have additional questions, feel free to contact us at bepreparedsolutions.co. Check out our articles. We have teaching articles. Jobs not to try to make you a medic. Go for an EMT training if you want that. Not to try to replace your doctor. As Tiran said, this is when and if you need emergent, immediate help, and help will not arrive in time, or it will not arrive.
I want to add, one of the things that you spend so much time building our kits is selecting elements. And people don't realize that our kits are made from components that we help our customers get directly from Amazon. But the nice thing is you've gone through a lot of the elements that are not here on the table yet to assemble kits that give you the combinations of what you need.
Yeah. These are just highlights, and every single item that is in our kits, I personally own and or have tested or have one identical to it by a different brand. And they have been thoughtfully put together so that way you don't have a pinch point, or it's one level more than what you may need. It's a slight escalation. And then when you're choosing those, we explain it. We explain some of the things that were in our thinking of why we selected the items, when and how you would use it, and also pointing out some of the, I call it the gotchas, the aha moments that we've experienced. So
check out more videos in our channels on medical kits and supplies, and we'll see you the next time.
from our family to yours, we hope it helps. BePreparedSolutions.co. Thank you.